Welcome back. I'm Michael Bull, and this is the Commercial Real Estate Show. Thanks for being with us today. Today we're talking about the healthcare industry and healthcare real estate. Please welcome my guest, Paul Zeman. Paul is president, National Healthcare Capital Market Group, and partner with Bull Realty. Paul and his team become known as the go-to brokers to buy and sell medical office buildings. Paul, thanks for joining us today.
Good morning. Enjoying being here.
Also, please welcome Henry Johnson, Chief Strategy Officer, Freese Johnson. Freese Johnson is a design, build, and general contracting company that has been very active building medical office buildings. Henry, thanks for joining us.
Thanks. Good to be here, Michael.
Well, gentlemen, you heard John Sweet's view on the demand for medical office space and what he expects moving forward. What do you see in your practice? How significant is really the increased demand in the medical office space, or is it significant?
You know, Michael, it is significant, and there should always be a need for health care, and how strong that need is still going to depend on a lot of factors in any given market overall. How close nearby referral sources are, the proximity of a property to a hospital campus, and just the demographics overall.
Yeah, and so your investors are pretty bullish on buying medical office buildings, so obviously they expect demand to increase, right?
Absolutely.
And you're building these medical office buildings, and I guess you're building mainly for users?
We're partnered with healthcare systems, users, so they're private practice groups that want to own their own real estate, projects that hospitals have been involved with, but it's definitely been busy.
Yeah, so you're seeing a lot more demand than you did a few years ago, now that people are seeing what Obamacare is doing or not doing?
We are. I think the pure impact of that is yet to be seen, but obviously I think the velocity of our projects, we're probably seeing twice as much volume as we did this time last year.
That's interesting.
I was just looking, I've got an article here from the National Real Estate Investor where they talk about just the Southeast, there's $2 billion in new MOB projects planned for the next 2 years. That just gives you an idea, just one region of the country where it's just on fire.
Yeah. Well, Paul, of course, it depends on the actual building and the submarket, but overall, how are investors, providers, and their lenders underwriting future demand when it comes to rates and vacancy?
I'll reiterate what you said, Michael, about the investors being very bullish. In fact, they are, and a lot of them have got a very severe need to deploy capital. But as far as the underwriting goes, a lot of the properties that I work with, they're mostly institutional quality assets, and the underwriting is largely spelled out in the leases. So there's only some interpretation on the underwriting there, and not a lot though.
Yeah. And Henry, what do you see there when you have these healthcare systems, if they have vacant space, do they tell you how they're underwriting, when they expect to fill the space, or how much demand they're expecting?
I think the dynamics of underwriting these projects have probably gotten a little more difficult. Now, we at Freese Johnson, we do a tremendous amount of physician-owned properties. So some of these are developer-driven, some of them are physician-owned properties where they are developing their own real estate with help with guys like us. But I think the dynamic is different now that the hospitals are engaged, because you've gone from having doctors and physician groups that maybe sign short-term leases. Paul, you might see this as well. And now you have hospitals that are doing bigger deals, signing bigger leases, and they've got better credit.
Right, and we like that, don't we? And what about Obamacare? How has that impacted demand for the space at this point? Paul, are you seeing more demand?
Michael, I am seeing, more so than just what I would classify as more demand, but I'm seeing the large physician practices being a little bit more comfortable with where they are right now, and where maybe in 2011, 2012, they were kind of on hold with some projects. A lot of them are pushing on. But something else that we're seeing, that there are so many physician practice acquisitions going on with the hospitals, that the hospitals are being more aggressive leasing space, especially off campus out in the suburbs, where they're reaching out to a larger audience. And sometimes we see the hospitals leasing space, not necessarily intending to use it immediately, but they just want to have a really nice, beautiful office somewhere to make it more attractive to other physician practices they're thinking about buying. It's like, hey, we'd like to move you here. So.
Okay. And how do healthcare providers feel about Obamacare today? If you ask them, how you feel about it today compared to 2 years ago, what are they telling you?
Michael, I had a conversation this morning with the CEO of a very large orthopedic clinic, and he was very frank with me that he doesn't like it. I think that initially many of the large physician practices feared that this was the first step towards a single payer or Hillary care, and we haven't heard that in a while. But his biggest frustration revolved around the lack of reporting amongst the exchanges, and it's really difficult to manage these patients' levels of eligibility. Have they paid? Have they not paid? They might have paid 90 days ago, but they come in for today's visit and they're not up to speed. The practice doesn't know it, and ultimately they don't get paid. But it was put to me in very simple terms that they would really prefer that healthcare insurance be purchased more in a manner like buying car insurance, where if you're 400 pounds, you're diabetic, you've had 3 heart attacks, you're going to pay rates equivalent to the 25-year-old kid with 3 DUIs driving his dad's Ferrari with a dozen speeding tickets. Okay, so they'd like to see something more along those lines.
Yeah, well, that'd be interesting to see how that would turn out. But some physicians are fond of Obamacare, aren't they?
I really don't see it in the folks that we're talking to. I think 2 things are for certain. There's more paying customers. There's more capital than ever before. So I think those 2 things are certainly a plus for our industry. But, talking to the various physician groups, I think John hit the nail on the head when he said uncertainty, because that's probably the most common word used in having these discussions.
And if you polled these physicians today, what would they say?
That's a good question. I went when I was looking at that question. I went and did a little search on. We're members of MGMA, Medical Group Management Association, and they just issued a survey in May of 2014 where they included more than 700 groups and 40,000 physicians, and what was the impact of the Affordable Care Act on their particular practice? Of those, 2.5% said positive things about it. More than 56% reported no change in volume at all in their patients. So I think, and speaking with all these practices is unique, because you would think intuitively that there would be more patients out there that would be overwhelmed. But I think there's 2 things going on that, one, there's uncertainty about reimbursements, and that's really going to continue for a long time. And 2, with the insurances, I think a lot of people have signed up, and now their insurances may be more narrow than they thought. So these groups have some of the employees have extremely high deductibles. So I heard from a provider recently, and he said that they're actually having less patient volume because the deductibles have gotten so high that the folks that normally came to the doctors on regular scheduled visits aren't. So that was an interesting twist.
Right. And Obamacare aside, you have a lot of other factors that are going to increase demand for healthcare services and medical office space. You have the baby boomers coming of age, right? You have a very health-conscious America, or at least in California, right? Maybe. That's right. So there's more doctor visits. So there should be more demand overall, regardless of Obamacare, shouldn't there, Paul?
Theoretically, there should be. That's the big mystery with Obamacare, is that we know that it's going to increase patient volumes. By how much, we don't know. And it's going to decrease physician reimbursement, and by how much, we don't exactly know.
But the big numbers that we were hearing a few years ago about the increased demand really haven't been there, would you say?
It's hard to really quantify that. We see, some studies of how many additional square feet per additional insured would be needed. Really kind of intricate math.
All right, we'll have more in a moment. This is the Commercial Real Estate Show. We'll be right back. The Commercial Real Estate Show is brought to you by Florida International University and Bull Realty Commercial Brokerage, a great place to do business. For more information on these companies or to access additional podcasts, videos, or blogs, visit commercialrealestateshow.com.